In this video, we will show you how to properly measure out your dose and perform an intramuscular testosterone injection. These are the supplies you will need: your vial of testosterone, 1 alcohol prep pad, a 1 ml syringe, and a 25 gauge needle. It's important to use the right size needle to perform an intramuscular injection. It must be at least 1 inch long in order to get through the fat and into the muscle. Make sure you wash your hands before starting. Go ahead and open the syringe package. Now it's important not to have any cross-contamination with your supplies, so use sterile technique throughout this process. You don't want to pick up any germs that could cause an infection. Next, we're going to set up the syringe for drawing out the testosterone solution by tightening the needle onto the syringe. Before you draw, you want to double check and find your doctor's prescribed dose of testosterone. On the medication label or packaging, you will find your doctor's prescribed dose that your pharmacist was nice enough to write down for you. For example, it might look like this: 100 milligrams or 0.5 mLs 1 time per week. So if our strength of testosterone is 200 milligrams per ml and your dose is 100 milligrams, then you need to draw out half of your 1 ml syringe, or 0.5 mLs as it says on your prescription. Next, we want to prep the vial of testosterone by popping off the plastic safety cap and making a quick wipe of the rubber stopper with an alcohol prep pad. Next, we need to equalize the air pressure inside the testosterone vial. As you draw testosterone from the vial, it creates a vacuum, so you will need to equalize its pressure or else it will be difficult to draw out the solution. Draw 0.5 mLs of air into the syringe by pulling the plunger halfway back and filling the syringe with air. Now, using a special technique, apply downward force to the rubber stopper using the needle bevel side up and at a 45-degree angle. Then bring the needle straight up and insert it into the vial. This will prevent small chunks of the rubber stopper from breaking off into the vial and extend the life of the stopper. Now, inject the air. You want to perform this technique before each injection to ease the draw of the solution. Now your testosterone vial is prepped and ready for the draw of 100 milligrams or 0.5 mLs. Invert the syringe and vial of testosterone. Pull back on the plunger until 0.5 mLs of testosterone is drawn. It will be written clearly on your prescription packaging what dose and how many mLs to inject, which will correspond to the numbers on the syringe. If there are any trapped bubbles, give the syringe a few flicks to release any large ones and push them back into the vial. If you notice tiny air bubbles within the syringe, that's normal. They won't cause you any harm. Proper injection site is easy to find. Just draw an imaginary cross centered on the glute muscle. Your injection area is going to be this upper outer quadrant. Anywhere in this area is fine. Next, using your alcohol prep pad, clean the injection site. Now we take our syringe and with a swift dart-like motion, inject the syringe. After the needle is all the way in, pull the plunger back slightly and look for blood in the syringe. In the rare occurrence that you see blood in the syringe, then you're in a blood vessel and you just need to pull the needle out and re-inject in a different area. If no blood, then push the plunger slowly, injecting all of the testosterone. Then remove swiftly and quickly apply pressure with your alcohol prep pad. Sometimes you'll notice a small amount of blood or a mild redness, soreness, or inflammation at the injection site. This is all normal. If these symptoms persist and you develop a raised rash around your injection site, call your doctor.